So the problem that we have in the UK, we have about 9,000 adults who've got a high-grade glioma and about 1,500 kids. And overall the survival is very poor, so less than 20% of patients are alive after 5 years. So what neurosurgeons, when they're operating on the table, need is better markers to identify high-grade disease within the tumour. Because we know that if we can clear as much tumour as possible, then the patients have a slightly increased survival. So the aim of our study was to use a particular surgical biomarker which is called 5-ALA. This is a chemical that's normally in the body and it stands for 5-aminolevulinic acid, and it's normally metabolized to an iron product, say heme. What we know from previous work is that actually high-grade glioma cells don't have the right enzyme to break down this particular 5-ALA, so they get an intermediate product which builds up in the cells. And the useful thing about that product, called protoporphyrin 9, is that it fluoresces pink. So in the middle of the theatre, the neurosurgeon can turn down the lights, shine a blue ultraviolet light, and the high-grade areas of the tumour will shine pink. So the aim of our trial was to compare patients who had suspected high-grade disease on a scan, so that was centrally reviewed and locally reviewed, and to see whether they had high-grade disease on biopsy, which is our gold standard, and to compare patients who had no evidence of fluorescence. And the interesting thing that we found was that actually 5-ALA is an incredibly sensitive and specific biomarker of high-grade disease. The only drawback with 5-ALA is that it can cause a side effect in some patients, so they can have a photosensitive rash or they can have problems with their liver disease, but otherwise we know it's safe, so they can take it a couple of hours before surgery. The other thing is that in our patients who didn't have visible fluorescence, we had evidence of low-grade disease. So an ideal biomarker, as well as getting high-grade disease, would also get low-grade disease. So looking to the future, we might want to look for other biomarkers of low-grade disease, and also can we somehow add a treatment onto this particular 5-ALA, because we know it gets into more aggressive tumour cells. The really good news is that NICE, which is the agency in England, has approved 5-ALA now, so that in all units in England it's being used. It's being rolled out in America, in Europe, and I know in Scotland also, where we are now. So hopefully it should improve the lot for these patients with high-grade glioma.